Hello, my name is Dr. Roger Henderson. I'm a GP in southwest Scotland, and I also co-host the GPnotebook study groups. Welcome to this GPnotebook podcast again, where we discuss bite-sized topics aimed at all those working in primary care. Now, you can find us on all major podcast platforms, including Spotify, Apple Podcasts, and Google Podcasts. So do please follow us to receive notifications about new episodes. And if you like what you hear, do please consider leaving a review to help other listeners find us. You can also follow us on Twitter at GPnotebook for more information about new podcast episodes. Finally, you can visit GPnotebook.com for podcast episode show notes and to find out more about upcoming study group meetings which occur all year round. Now, in this episode, I thought I'd discuss an exciting new genetic treatment for sickle cell disease that's just been announced by NHS England. But just to remind us about the basics of sickle first though, sickle cell disease, or SCD, is a group of inherited blood disorders that are characterised by the production of abnormal haemoglobin, known as haemoglobin S. And it primarily affects individuals of people of Black African and Black Caribbean heritage. And we think about 15,000 people in England alone live with the condition. Now, it's an autosomal recessive disorder, meaning that a person must inherit 2 sickle cell genes, one from each parent, to have the disease. And individuals with only 1 sickle cell gene are carriers, the sickle cell trait, and usually don't exhibit symptoms, but they can pass the gene to their offspring. Now, sickle cells have a reduced deformability and they're easily destroyed, and this can cause occlusion of the microcirculation. And there's often a chronic hemolytic anemia with a median hemoglobin concentration level usually around 9 grams. Sickle cells have great difficulty passing through blood vessels at times, and this can lead to blockages, reduced oxygen delivery, and an increased risk of complications. Sickle cell anemia is the name of the specific form of sickle cell disease in which there is homozygosity for the mutation that causes HBS. Now, symptoms of SCD vary widely in severity and frequency. But common ones include pain crises, anemia, swelling in the hands and feet, frequent infections, and even delayed growth and puberty. But episodes of severe pain, known as vaso-occlusive or sickle crises, are probably the most common, and these occur due to sickle cells blocking blood flow, with the pain commonly affecting the chest, back, arms, and legs. Now, over 90% of hospital admissions for patients with sickle cell disease are for painful crises, but nearly all sickle pain generally is dealt by us in primary care. Now, when we look at the diagnosis of SCD, this is typically through blood and genetic testing. So with newborn screening, most developed countries conduct routine newborn screening in order to detect SCD early. Heel prick blood spots are usually collected 3 to 10 days after birth and the haemoglobin analysed. And this does reliably identify affected babies, and it allows penicillin to be started by the age of 3 months. Haemoglobin electrophoresis can identify different types of haemoglobin and confirm the presence of haemoglobin S. Full blood counts can obviously detect anemia and abnormal red blood cell shapes. And genetic testing using DNA analysis can confirm mutations and determine whether a person has sickle cell disease or is a carrier. Now, some of the significant complications that can be caused by SCD include stroke, caused by blocked blood flow to the brain, acute chest syndrome, which is a life-threatening condition caused by lung infections or blocked blood vessels in the lungs, organ damage due to repeated blockages, leg ulcers, and even priapism, the painful, prolonged erections in males due to blocked blood flow in the penis. And as I said earlier, the clinical severity of sickle is very variable, as is the prognosis, and this ranges from survival into old age to severe disease with substantial organ damage and an early death. Common causes of death from sickle are cerebrovascular accidents, sepsis, pulmonary hypertension, and acute chest syndrome. In young children with sickle, infection is the main cause. Now, until now, a bone marrow stem cell transplant is the only potential cure for SCD, but it's a high-risk procedure and it does require a well-matched donor, which is often a sibling. Now, because of its risks, it's generally been reserved for severe cases and there is often limited donor availability, unfortunately. This means that for most sufferers, other various treatments have to be used to help manage their symptoms and reduce complications. Now, these include hydroxyurea, which can reduce the frequency of crises in sickle cell disease, as well as the episodes of acute chest syndrome. But because concerns remain about its myelosuppressive and teratogenic effects, it should always be stopped at least 3 months before conception. Analgesia can help manage vaso-occlusive crises, and regular blood transfusions can help prevent complications such as strokes and severe anemia, and are really a key intervention in decreasing morbidity and mortality in patients with sickle. Now, oral penicillin prophylaxis is started at diagnosis, and the risk of pneumococcal infection remains high but does slowly decrease with age. And children should also receive unconjugated pneumococcal vaccination from 2 years of age, repeated every 3 to 5 years, and immunization against meningococcus, influenza, and hepatitis B. Now, the goal of new genetic therapies for SCD is to treat or cure the disease by changing or adding DNA. And this is where the one-off treatment Casgevy, also known as Exocel, does appear to hold a very real prospect of a cure. This is gene editing therapy that's just been announced and will be offered to about 50 patients a year on the NHS in England, in specialist centres in London, Manchester and Birmingham, to people aged 12 and over who get recurrent sickle cell crises and who cannot find a donor for a stem cell transplant. Now, with this treatment, the patient's blood stem cells are edited in a way that makes them produce high levels of fetal haemoglobin, which is produced during fetal development and binds to oxygen more strongly than adult haemoglobin. And as you might expect, it's a multi-step process. So just going through these, as a first step, patients receive blood transfusions which help minimize the number of sickle cells in their circulation. And this can usually be done on an outpatient basis, and it takes multiple transfusions over a period of about 2 months. Next, the patient stays in hospital for about a week to have their stem cells collected. Now, in the laboratory, a gene editing tool called CRISPR is then used that allows a specific gene to be pinpointed and very precise editing to take place. And this can take a few months. But instead of directly editing a faulty gene, Casgevy takes advantage of a process that happens when the babies are in the womb. And so, crucially, fetal haemoglobin is not affected by sickle cell disease. So CRISPR acts by dampening down the switch that makes the body produce the adult form. Patients also have to undergo conditioning chemotherapy to make sure their bodies are ready to accept the edited stem cells. The modified stem cells are then transfused back into the body, where they multiply and increase the production of stable, well-functioning red cells. And the patient would typically remain in hospital for about a month whilst these cells begin to take hold and their immune system starts to show signs that it's coming back in a robust way. Now, this full treatment obviously must be considered carefully because, as you can see, it can involve lengthy stays in hospital and it may also have side effects, including bleeding problems. But Casgevy has been studied in a multi-centre trial that involved adults and adolescent patients with a history of sickle cell crises, and over 90% reached the goal of having no pain episodes for at least 1 year during the 2-year follow-up period, and trials are obviously ongoing. Now, this type of therapy has already been approved for transfusion-dependent beta thalassemia and is being given to patients in other countries such as France, Germany, and Italy. Now, with a bone marrow transplant, patients stay in hospital around 6 weeks or so. They take immunosuppression medication for 6 to 12 months, as well as multiple other medications. But with Casgevy, the immune system recovers much faster because it uses the patient's own cells. Now, there is a small matter here of the treatment price tag, over £1.5 million per patient, and not everyone with sickle cell will be eligible for it. However, NHS England has struck a deal to access the treatment at a reduced price for taxpayers, enabling it to be offered through the Innovative Medicines Fund, which fast-tracks funding for new medicines. And Wales is also expected to start providing it in the next few months. However, the fact that this groundbreaking gene therapy treatment is now becoming available on the NHS is a huge milestone for the sickle cell community, and we all must be aware of it in our practices, as I've no doubt that many patients with sickle will now be asking if they may be eligible for it in the future. So that's a quick overview of Casgevy, the new genetic treatment for sickle cell disease, and I do hope you found it as interesting as I did. But do have a look at the show notes that accompany this episode at GPnotebook.com, and we'd be very grateful if you'd consider following the podcast and leaving us a review on your favourite podcast platform. Do feel free to get in touch via social media at GPnotebook or email support@GPnotebook.com if you've any questions, comments or ideas for future podcasts. You should also visit us at GPnotebook.com to register for our virtual GP Notebook study groups, which occur year-round and have a huge list of different topics, and to download free shortcuts to help improve the lives of our patients in primary care. But as always, until the next time, thank you for listening and goodbye.